हाँ सर, अब क्वेरी सेशन स्टार्ट होता है और डॉक्टर जी ओम प्रकाशम जी अनम्यूट कर लीजिए।
नमस्कार जी, मैं तेलंगाना से आया, हैदराबाद से। फर्स्ट सेमिस्टर हो गया मेरा। What is the main reason for the constipation? It starts from stomach or small intestines or large intestines. If all are affected, how to treat? Start the treatment, sir.
Sir, actually, on the basis of the symptoms, we can know what part of the GIT is affected.
Sir.
Within the 30 minutes, if you have something uneasiness, after taking the food, at most there is for the preparation of the bolus, it takes 2 hours. But in between 2 hours, yani 30 minutes, 1 hour, if there is something wrong, there is a not easy feeling, and there is some burping or something like that, so the stomach is affected. When it is forwarded to the duodenum, that is the first part of the small intestine, and the duodenum is its structure is like sickle and having the curvature, and there are the 5 parts. If it goes, it is forwarded, that bolus is forwarded, and in between the stomach and the small intestine, there is interference of the bile, which is secreted by the liver and gallbladder, and that is essential for the digestion of the fatty food. It takes much of the time. If your gallbladder is embedded, is full of the small concretions, stones, there is the secretion of the bile is less, and there will be heaviness and some that is bad feeling in the right side before around the lower part of the rib cage. So that story goes, it takes long process. That's why there must be difference between 2 days of the 9 hours. But what we do, कि जो चीज अच्छी लगी, किसी ने कह दिया चाय पी ली, चाय के साथ बिस्किट ले ली, और some garmot and all that. और ये courtesy is very costly for digestive system. और हमारी जो खाने की प्रवृत्ति है, quality and quantity, that also is the causative factor for the constipation. Overall, constipation is not the easy as we say कि लोग कह देते हैं एक पॉइंट बता दीजिए सब हमें constipation रहता है दूर हो जाए. The whole of the system, right from the pair of lips and the 32 teeth, having discharging the different holes for the mastication, physical, and now afterwards the chemical digestion by secretion of the hydrochloric acid from the wall of the stomach and all that. It's a very long process. If it goes well, so for research section we have prepared the protocols, and so many protocols after the long observations and considering all the factors. That's why there are a few more, little bit more points, but it is effective for all, not only the constipation that release the acidity, gastric, and peripheral symptoms. Sometimes appendicitis or the hepatitis, and there are several nomenclatures, but अगर आप शुरू से ही कुछ ध्यान देते चलेंगे तो सब कुछ ठीक हो जाएगा. और I hope that this reply may not satisfy to you. But if we apply the colors after the Vayanam left hand channel, one number 012 black color. Every 15 days you will get reply that uh, the atmosphere of the entire GIT is controlled by these 3 points by applying black color, which is responsible for macrophaging and removing the infective etiology, and as well as it paved the way to the spore selling of the spore propulsion of vestigial material throughout the gut. Okay, is it?
So if all are affected, we have to treat all, sir. If all are affected, all should be treated at a time, or to start with stomach.
It is the nuclear treatment. Or these are 3 chakra 0 and 2 Vayanam. And when you apply such things, then you can get reply. And our experience also speaks about that LI-0121 and SI-01 sedate. That is very powerful treatment. There are so many modalities, so many protocols you can apply. Okay?
Okay, sir. Thank you.
But you must, apart from these black colors, LISI, LI-0124 and SI-01 sedate was, and along with right angular 012 spiral 3 sedate 1. It controls the activity of the stomach and rest of the GIT by LISI. It is sufficient and very powerful. Next.
BP
Namaste,
count
sir.